is touched in different places. The person is then asked to point to each place that is touched. This exercise should be done with the patient's eye closed. If the person cannot feel the points of contact within the skin patch but does point to other places where the skin is normal, diagnosis of leprosy is. Now test the function of each of these nerves by sensory testing over the skin supplied by these nerves and by performing voluntary muscle test, that is VMT. While eliciting sensation in hands and feet, check the sensation in the palms of the hands and the soles of the feet using a ballpoint pen. In the palm of the hand, the side with the little finger is supplied by the ulnar nerve. The part with the thumb, index and middle fingers is supplied by the median nerve. The sole of the foot is supplied by the posterior tibial nerve. Explain the test to the patient. Ask them to close or cover their eyes. Touch the skin very lightly with the ballpoint. Ask the patient to point to the place you touched. Test a minimum of 4 points on each hand and foot. Note any areas where the pen is not felt. Nerve function. Definite nerve enlargement with loss of sensation or muscle weakness in nerve area is diagnostic of leprosy. See the nerves which are commonly affected and found enlarged in leprosy. They are: the great auricular nerve on the side of the neck below the ear is sometimes visibly enlarged. Gently feel it to make sure it is the nerve, solid, and not one of the veins in the neck which is full of fluid. The ulnar nerve at the elbow. The radial cutaneous nerve and median nerve at the wrist. Common peroneal nerve at the knee. And posterior tibial nerve at the ankle. All these nerves should be gently palpated on both sides. Practice the palpation of these nerves to find their thickening, consistency and tenderness. Thickening can be judged by rolling the nerve by pulp of Check for muscle weakness by performing at least 3 key muscles. One, thumb up test for the median nerve. Ask the person to put their hand palm up. Ask them to point the thumb towards their own nose. Test the strength of the thumb to stay in that position. Two, little finger out. Test the ulnar nerve. Ask the person to put their hand palm up. Ask them to move the little finger out. Test the strength of the little finger to stay in that position. Three, foot up to test the peroneal nerve. Ask to point the foot up to the roof. Test the strength of the foot to stay in that position. Muscle strength is recorded as strong or S, weak or W, or paralyzed P. Strong or S means that the muscle being tested is of normal strength. Weak or W means that the muscle can move but is definitely weak. And paralyzed or P means that the muscle cannot move at all. Examine both eyes. Check the visual acuity of each eye separately. Ask the person to count fingers at 6 meters. If the person cannot count fingers at 6 meters, they are visually impaired and have grade 2 disability in that eye. Look for an inability to close one or both eyes, lag ophthalmos, and check the normal strength of eye closure. Look for any redness of the eye. How is disability assessed and recorded in leprosy? Disability is a broad term covering any impairment, activity limitation, or participation restriction affecting a person. We need to know how the disabilities are graded. Every new case of leprosy must be assigned a disability grade, not deformity grade. It depicts the condition of the patient at diagnosis. The grade is on a scale of 0, 1 or 2. Each eye, each hand and each foot is given its own grade, so the patient actually has 6 grades, but the highest grade given is as the disability grade for that patient. Grade 0 means no disability found. Grade 1 means that loss of sensation has been noted in the hand or foot. The eyes are not given a grade of 1. Loss of sensation in the hand or foot means that one of the main peripheral nerve trunks has been damaged by leprosy. Grade 2 means that visible damage or disability is noted at peripheral parts. For the eyes, this includes the inability to close the eye fully or obvious redness of the eye. Visual impairment or blindness is also given a disability grade of 2. For the hands and feet, Visible damage includes wounds and ulcers, as well as deformity due to muscle weakness, such as a foot drop or a claw hand.